Hi, I'm John Barker and I'm a senior.
Jacob Moss, also a senior.
Jimmer Mangales, I'm a senior.
And Erica Hernandez, I'm a senior.
And today we're going to demonstrate to you the palpations of the lumbar spine.
Let's get started.
So to locate the iliac crest, I'm going to look for the ASIS, which is right here. I'm going to walk my fingers over to the back of the patient until I find the PSIS, and that should be the iliac crest, and I'm gonna palpate for both sides, and the middle should be the lumbar spinous, and for the sacral process, I'm gonna look for the PSIS, which should be inferior of the iliac crest, and should be the dimple, this part, and the middle part should be the sacral process.
Find the ischial tuberosity. You can have your patient lie down on his back or standing with the bent knee. First, you're going to find the midline of the gluteal muscle and work inferiorly. You'll feel a pointy, bony prominence, and that is the ischial tuberosity. Next, we want to find the greater trochanter, and from the ischial tuberosity, you're going to move laterally and slightly inferiorly, and it'll be right about here, and it's going to be a large bony prominence. And to help you find it even better, you can internally and externally rotate the hip, and you'll feel it glide underneath your fingers. And then next, we'll find the sciatic nerve, and it's going to be halfway in between the greater trochanter and the ischial tuberosity. So connect an imaginary line between the 2 points, and halfway in between there is the sciatic nerve. You may not be able to palpate it, but some patients will have a tingling sensation.
Okay, so now we're going to find his anterior superior iliac spine. For him, it's going to be right above his waistline or his pant line. So it's going to be about here, and you'll feel a bony prominence. I'll just glide my thumb across it, and you should feel it pretty prominent. And then where my hands naturally lie this way will be his anterior portion of his iliac crest. And then from there, if his ASIS was hard to find, I could go 3 inches above his iliac. From his ASIS to find his iliac tubercle, and then I can run from his anterior iliac crest, find his iliac tubercle, and run down to his ASIS.
So in order to palpate Mcburney's point, what we're going to do is find that ASIS that we talked about earlier, the bony prominence at the top of the hip bone, and then you can kind of draw a line straight to your umbilicus or the belly button, and you want to go 1/3 of the way up from the ASIS. And it's kind of a soft tissue spot, typically where the appendix lies.
Go ahead.
Alright, so in order to illustrate the femoral triangle, we've laid out a few bands so you can kind of see where the underlying muscles are. The red band represents the sartorius, which kind of runs, from the lateral portion of the hip bone down medially toward your patella. And so that's this red band tracing across right here. The green band represents your adductor longus running along the medial aspect of the leg. And this yellow band is going to represent the inguinal ligament. And so this area kind of represents the femoral triangle as a whole. In the middle, you can palpate, there's going to be some lymph nodes in there, as well as the femoral artery. So really, you just want to get kind of that medial aspect of the leg. That's it.